Hi, I wanted to go over a few simple, easy things that I've seen help my patients in the office dealing with sciatica, not just preventatively, but also if they're currently dealing with it. One of the first and foremost important things you can do to help sciatica is to stop sitting. Sitting puts so much compression on the discs on the front, it causes the discs to bulge posteriorly or towards the back, and so we need to stop sitting. So the first thing you can do, the do's and don'ts of sciatica, first, stop sitting, stop bending forward, stop reclining, lazy boy chairs, bending forward. First thing to do is to try to lay down. Take the weight off the disc. You don't need to be fully upright or arching up. It can be laying flat, but you're trying to take the weight off the spine, get the weight to be decompressed off the disc. You can try to bring one knee up from the side. So if you bring your left knee up from the side while you're on your stomach, you can try arching up a little bit, but you can try bringing your left knee up. That'll open up the right lower back. So if you're having right leg sciatica, that can relieve nerve root pressure on the right side. Also, if you're having, say the sciatica is going down your left leg, you can try bringing your right knee up from the side. That'll relieve left sciatica. This will relieve at least the mechanical part of the nerve compression. So if the nerves are compressed mechanically, laying down will relieve that. Sometimes the nerve can be irritated by the soft tissue that's around the nerve, so it won't matter. So you might say, I'm laying down and I'm still having pain. That's because the nerve is actually sitting in lactic acid or acidity. So it's regardless if you're upright or laying down, you'll still have pain, but laying down will remove at least that one component of mechanical compression, and so you'll feel a little bit better just laying down. Stop sitting. The second thing that really helps my patients is to stop putting heat on their lower back. Heat feels really good. Heat causes an analgesic effect. It actually blocks nerve sensations. Heat sort of takes a precedence from other pain sensations. So standing in a hot shower, putting heat on your lower back will feel really good. Heat sort of feels good, and I think sort of naturally we like to put heat on things. The muscles are tight in the lower back, so when you're having sciatica, you'll feel a lot of tightness from the nerves actually being pinched. So the nerve pinch causes muscle contractions, sort of the muscles are being tasered by the nerve. And so heat sort of feels good. It has an analgesic effect. It blocks pain sensation. So it feels good to put heat on our lower back. Classically, either with a heating pad or in the shower. We stand in the shower rounded forward, putting heat on the spine. People will stand there for 20 minutes with heat on their lower back, and it feels really good. And then maybe a half hour after you get out of the shower, you're left with, oh my gosh, my back is actually worse now. And we don't connect the dots that heat actually inflamed the nerve more. Because the disc is made of 70-80% water, heat swells the disc. So if you're having a bulging disc, it'll cause it to bulge more. If it's herniated, it herniates more. Heat causes the disc to swell, so we need to stop putting heat on the lower back. You can't, the muscles are tight, so heating up the muscles, while it might not make sciatica worse, it will feel good to put heat on the muscles, but heating up the muscle itself won't fix the problem, because the muscle, say if your hamstrings are tight, which is a common thing I see with sciatica, the hamstrings are tight because the nerve is pinched. So heating up the muscle will make the muscle feel better, but it won't ever relieve the muscle contraction, because the nerve is actually what's pinched that's causing the muscle contraction. Icing your lower back, usually on the side that the sciatica is on. So if it's on your right side, you'd ice the right lower back for about 12 minutes. Take a 20-minute break, ice it again for 12 minutes. You should see the pain coming down a little bit with the ice. You want to keep the ice cube moving, so don't just place ice on your lower back. Keep the ice cube moving. The ice will cause the disc to contract a little bit, help to relieve some of the herniation and the bulging. But 12 minutes on, 20 minutes off, preferably to be used when you'd be icing laying down. You don't want to be icing sitting. So if you're sitting causes that disc to compress, because like I said, it's made of 70-80% water. The mechanical compression of the disc is what's causing it to herniate, hitting the nerve. You don't want to be icing while you're sitting. Preferably you would ice laying down. You'd lay, if you're by yourself, you'd lay on your side. You'd hold the ice cube with a paper towel, and you ice your lower back on that side. So if it's your left leg sciatica, you lay on your right side, ice the left lower part of your back about 12 minutes or till it's numb. Take a 20-minute break. Keep the ice cube moving. The other way is you can take a styrofoam cup, you fill it with water, put it in the freezer, let it freeze, then rip off the top of the styrofoam cup, and then you have like a tool that you can use to ice your own back. If someone's at home with you to help you, it would be better for you to lay using the sort of the first step, which is to lay down. You lay on your stomach, trying to take the pressure off your spine, and then have somebody ice your back in the lower back while you're laying on your stomach. You can, if it's not too uncomfortable, to arch up a little bit. That helps to depressurize the front part of the spine, helps the disc to sort of a vacuum effect. It moves away from the posterior part or the back part, away from the nerves, and actually moves towards the front as you depressurize the front. So if you can handle arching up, if this causes too much pinching, you need to not arch up so much. So you'd actually just lay back down and have someone at home icing your lower back. Bending forward makes sciatica feel better, but the issue is I don't plan on living with my knee on my shoulder up here like this. I plan on being upright. And so the issue with doing too much piriformis stretching is that, one, the piriformis is tight because of the nerve, so it's counterintuitive to try to stretch a muscle that's contracted because there's a nerve pinch. So bending forward while you're sitting stretches that muscle, but it's sort of very short-term relief. It doesn't give any long-term relief because the nerve is still being pinched in the lower back. We need to stop bending forward. So what I recommend, the third thing that you can do to help sciatica would be to lay on your back with a rolled up towel. Sort of have a rolled up towel over your middle back. Might need to be a little bit bigger than this, but start small and then make it bigger. Have your knees bent just slightly so there's no compression on your spine. Very gently, you take your hands and push. Just trying to traction very gently your lower back. And if this causes any pain, you need to stop. Just trying to open up that lower back a little bit. Trying to get a good grip on your thighs and push. So the roller or the towel provides a little bit of extension, and then we're bending back, just tractioning that lower back a little bit. If you're in a lot of pain, one of the last things that you can do to help sciatica is put a back brace on. What a back brace will do is it helps to protect and guard the lower back. So if you're trying to get to your chiropractor's office and you're in a lot of pain, I usually tell people to actually lay down in the back seat or lay the seat back, put a back brace on, protect your lower back. That'll help it not move so much. Going back to what I said earlier about sitting, even though it feels good temporarily, is actually causing the disc to herniate more. So we have to stop bending forward. Even though we get relief doing it, you're actually setting yourself up for more problems in the long term. And then have somebody ice your back in the lower back while you're laying on your stomach would be the best way.
Daddy, I have a little question. I just had a question. Can I go upstairs and make looms now?